Arrhythmia just means simply that there is an abnormal heart rhythm. Okay, so when we tell a patient you got the arrhythmia, it just means that this patient has an abnormal heart rhythm, and there are many different types of heart rhythm. If I start, maybe I will talk about the commonest heart rhythm, irregular heart rhythm, which is atrial fibrillation. And atrial fibrillation tends to occur as we grow older and older. It's quite unusual to see in the young, but once you're 50, 60, 70, 80s, it gets increasingly common, such that by the time it's 70, when someone is 70 or 80 years old, it becomes the commonest arrhythmia that we see. Age alone can cause the heart to become irregular. If you have high blood pressure, if you have other forms of heart disease like heart artery blockages or heart valve problems, the risk is even higher. Now, why are we so concerned about atrial fibrillation? To us, it doesn't matter. The heart will always keep pumping. It will not stop. But this irregular heart rhythm causes the blood to flow in a less smooth fashion. And when that happens, it can form small blood clots. If these small blood clots in the heart come out and go to the brain, they cause a stroke. And that is why, as a cardiologist, we are very interested or very keen to treat patients with AF or atrial fibrillation because we want to prevent stroke. We are not worried about the heart, but we want to prevent stroke because one stroke, it can be a very devastating event for the patient and for the family. For the younger patients, most of the arrhythmias we see are either just very fast heartbeats because of a short circuit in the heart. So the heart has electrical currents. So sometimes these young patients are born with what we call extra nerve, like a short circuit. And if you can imagine a short circuit, it keeps running in the circus. The electrical current keeps running and running, the heart goes fast. But these, again, usually also do not cause any danger to their lives. But it can be quite annoying because they make them feel unwell and make them feel breathless. For most of these patients, some medicines may slow the heart rate down and control their arrhythmia. If not, there is a procedure, a minimally invasive way where we can put small rubber tubes into the heart to burn off that extra short circuit or the extra electrical nerve. So I think arrhythmia is just a broad term, but we really need to see the patient to decide what he has and what treatment needs to be done.